All right. Hi, everyone. Welcome and good evening to everyone who's joined on this wonderful weekday evening for the session hosted by the George Washington School of Engineering. We've got an incredible next 1 hour worth of information for each and every one of you. We're doing this session hosted by Dr. Balaras, who's a professor of Mechanical and Aerospace Engineering, and we also have Miss Erin Vogt, who is the Senior Associate Director of Graduate and Recruitment at the George Washington Uni- University School of Engineering. And we've got a wonderful topic coming up at the crossroads of engineering and medicine, treating congenital heart disease using clinical image-driven high-fidelity simulation. So there's a lot of engineers in here. Just wanted to quickly ensure each one of you can hear me. Why don't you tell me in the chat box which city you are joining in from? Welcome, everyone. I think now you can go to the chat option on your screen, on your mobile devices, and please tell me which city you are joining in from. Okay, we've got Divya from Pune, we've got Ishan from Navi Mumbai, folks from Chennai, Accra. Welcome, Samuel, who's joining us from Accra, Delhi, Mumbai, Kerala, Belgaum, Pune. A lot of folks from Pune, Mumbai, Belgaum. We've got Manar who's joined us from Karachi. Welcome to our friends from Karachi and different parts of the world. A lot of students coming in here from Mumbai, Pune, Delhi, Belgaum, Chennai as well, Karnataka. We've got over 200 people in this room already. So if you've got some of your friends who have registered for this session, please do invite them to attend this session. We have some space in the sessions too, in case you have friends who are interested to pursuing a master's in the US, especially a MS program in engineering. That should be very insightful. Welcome to folks coming in from different parts of the country. Great. So without further ado, I want to start off with a quick introduction of the panelists here today. I know I spoke about them in brief, but a quick introduction about the panelists. We've got Dr. Balaras, who's a professor of Mechanical and Aerospace Engineering. His laboratory for computational physics and fluid mechanics aims to develop robust numerical techniques for parallel simulations of multi-scale, multi-physics problems in the physical and biological systems. He spent a lot of time, with projects in multi-scale models for blood damage in cardiovascular diseases, bio-inspired separation control, direct simulations of air entrainment in the turbulent boundary layers, and assessment of surgical procedures using high-fidelity computation models. So, professor of mechanical and aerospace engineering with a lot of knowledge and projects with medicine as well. So hence he's going to talk to us a little bit about the crossroads of engineering and medicine and how both these two different fields have a lot of interconnections. And we also have Erin, who's the senior associate director of graduate recruitment and admissions at the George Washington School of Engineering and Applied Sciences. She's got about 10 years of experience, and she's going to be the best person to help you in case you have any questions about the university or about different concepts about the admission procedure and how you stand a chance to get an admission at the George Washington School of Engineering. Just saw a comment that my voice is a bit glitchy. My apologies for that. Hopefully this should help and work better. But you're not here to hear me. You're here to hear Dr. Balaras and his presentation about the crossroads between engineering and medicine. And that's what we will have now. I'm going to add Dr. Balaras to Spotlight, and over to you, Dr. Balaras. Firstly, thank you so much for taking our time this morning and joining us. And about close to 300 people are going to listen to you about this wonderful, exciting topic that you have.
No, thank you so much for the introduction. It's a great privilege to be here. Actually, I see more than 300 participants, and I'm really excited to share some of the work we do here at GW. So you all know that engineering today becomes more and more diverse and multidisciplinary. We have a lot of new things going on, artificial intelligence, supercomputers, and all sorts of different things are happening. And this is practically shaping the future of engineering. But at the same time, engineering impacts also several other disciplines, and medicine is one of those. And I want to talk about that today and give you an example of how we as mechanical engineers, bioengineers, can really change the path of medicine or contribute to that path. So let me share my screen, and I have a presentation prepared. Okay, let me see. So I hope everybody can see my screen. What I will talk to you today is basically how can we use simulations, high fidelity simulations, to treat congenital heart disease. What I will be talking about today, it's not something that is completely new. It did not appear, the last few years. But if you look back into 10, 20 years back, you will see that what we call cardiovascular modeling, which is basically the development of models for the heart and the large vessels around our heart, has been developed over the years to assist clinicians in treating disease and personalizing treatment for various patients. At the same time, this was also used as a way of inexpensive testing of biomedical devices. So, I don't know, an example of a biomedical device is it's an artificial heart valve. So people that have diseased heart valves and they need a replacement, they get implants. So these implants, before they are approved for use for patients, they have to go through very lengthy clinical trials and so on. That increases the cost of development. So simulation tools, such as the ones I will be talking about today, what they are doing is that they are practically reducing the cost, since you can test prototypes in an inexpensive way on your computer, as it's done actually in many industries like automotive, aerospace, energy. This is done for years, right? When you're developing a new car, a new airplane, there's a lot of testing that is done on the computer. And actually, these are the tools that we started to use initially. These are tools that have been used for other industries. We adapted them and brought them into the biomedical field. But as we're making more and more progress, these tools are now much more specialized, as I will show you. And they have become more complex, and they incorporate biological and physiological complexity that you only find in the human body, and you don't find, for example, when you're designing the aerodynamic shell of a car or an airfoil on an airplane, right? So this is what makes these simulation tools unique, and this field unique. Now, rather than just generically talking about how these tools can assist various diseases, in treating various diseases, I want to focus today on a specific example. And I picked this particular example since the last 5 years. We are doing a lot of work with a team of pediatric cardiologists and surgeons at the Children's Hospital, which is very close to the George Washington University. It's one of the leading hospitals for children in the world. And I will talk to you about a very common congenital heart disease. It's called the Tetralogy of Fallot. So congenital heart disease, I'm sure most of you are familiar. If not, it's basically what happens when somebody is born with a heart defect. In a lot of cases, children are born, our heart, as you see here on the side, It has 4 chambers that are connected with 4 valves. So there is the left side, the right side, left ventricle, right ventricle, and the 2 atriums, right? So there are children, for example, that they are born with just 1 ventricle. These are single ventricle cases, or they are born with 2 ventricles that they have a hole in between them. They are, for example, lacking a valve in the pulmonary tract, and so on. So in other words, they are born with a physiology that it does not allow the heart to perform as a pump and distribute blood around the body. And as a result, they are always subject to surgery maybe a few days after birth, because otherwise they cannot survive. So this is one of these cases, the Tetralogy of Fallot. So in this case, as you see here on the picture on the side, what happens is that the surgeons, they open the heart and they will patch the hole between the ventricles and repair the pulmonary tract and so on. And then this way the heart can start functioning, and all these kids survive after this surgery. Now, what, of course, it's a long-term problem with this type of procedure is that the pulmonary valve is not there, usually in most cases. And as a result, there is what it is called regurgitation. So in other words, the right ventricle of the heart, when it's expanding, has 1 valve closed and one open, so the ventricle is filled with blood. And then when it's contracting, the other valve closes and one opens, and then blood goes out. So when both valves are open, as in this case, because there is no valve in the pulmonary tract, then you have a situation where the heart cannot really work as efficiently. So why this is not repaired? You can understand that the implants and heart valves that are implanted to perform the function of the natural valve are done for adults. So you cannot implant something that has been developed for adults in a week-old child. And even if you develop something that is specific for this age, then the heart will grow and remodel over the few years, and then you will have to do multiple surgeries to replace these valves, which increases quite a bit the risk of survival. So, therefore, what the surgeons are trying to do is they are trying to find what is the right time as somebody grows up, what is the right time to implant the pulmonary valve. And this is actually a very controversial topic among this world of pediatric surgeons, and it is not clear what is the right timing for this replacement. So what do they do right now in clinical practice? Basically, all these patients are, they follow them regularly using MRI, magnetic resonance imaging. An MRI scanner, I don't know if you have ever been in one to get a scan of one body part. It's this scary machine that they put you inside, and then you have to wait for quite a long time. So that's the tool that is used to image the heart, and they are trying to identify whether or not the heart is working properly using basically size arguments. So this is what you can get from this. And when they see that the heart, for example, is growing at a larger rate, this means that it doesn't function properly. So then they will refer somebody for pulmonary valve treatment and replacement. However, these measurements have been inconsistent, and they do not really account for the dynamic factors like the pumping efficiency and other features related to the blood flow, right? So So there is a real problem out there, and there are lots of complications that are related to the timing of this valve replacement. So this is what motivated the project. And our motivation is coming from the fact that today imaging tools have advanced quite a bit. And as you can see here on this example I'm showing, this is what we call a 4D flow MRI. So this does not only provide the motion and the size of the ventricular walls, but with the colors here, you can see what is the velocity of the blood flow. These are quantitative velocity measurements. This provides us with the opportunity to calculate more sophisticated biomarkers to guide this valve replacement. For example, like quantities like vorticity. So most of you are engineers. You have taken, I guess, an introductory fluid mechanics class. So vorticity, turbulent kinetic energy, other quantities in the ventricle may be important in identifying a correlation between cases that they need replacement. Now, what is the problem? The problem is that this imaging data from that we call 4D flow MRI, they are of very limited resolution. So we have just 30 instances during the heartbeat, and then the resolution, the spatial resolution, it is very, very small. One voxel is of the order of several millimeters. So we cannot really compute these quantities very accurately. So what we decided to do as part of this project is to use computational fluid dynamics to factor this information in. As you know, computational fluid dynamics can be much, much more accurate in terms of spatial and temporal resolution. So we will use the imaging data to reconstruct the motion of the heart boundaries together with boundary conditions, like what is the flow through one of the big vessels, and then CFD can replace the information we cannot get from the scanner that is very low resolution. So that's the whole idea behind this project, and this will help us look into biomarkers in a large cohort of patients, more than 150 patients, and try to build correlations between specific blood flow quantities and the progression of the disease. So that's the background, and that's what we're trying to achieve. So what I want to tell you in the next few slides, what we want to discuss is how are we doing this? Because there are no tools out there that you can just go and download from the web or buy and do this. We have to develop all these tools from scratch to be able to do this efficiently and accurately. So therefore, as I said here, we will try to develop this workflow that you see down here. So we have clinical imaging data from different modalities, imaging modalities. Then we're going to develop some image processing tools that can extract the kinematics, basically, of the ventricular walls, and then convert these kinematics into a format that then a computational fluid dynamics simulation tool can understand, and then we can get the flow fields in much more detail than what you can get from the MRI scanner. So what are the imaging tools? So first of all, we use standard magnetic resonance data sets. So we have a set of what we call time-resolved CMR sign images. These are, as you can see here, you see a model of the heart and a series of horizontal slices, and we also get a series of vertical slices. And in those slices, we can identify how over 30 snapshots during one heartbeat, we can identify where the boundaries of the heart are. So this is one of the images. The other is what we call MR angiograms. This basically gives us what is a static image of the heart during peak systole, also with great detail. And we also have what we call phase constant imaging that we use it targeted at some particular vessel on the pulmonary tract to compute the actual flow rate. So we have some boundary conditions for our models. So these are the three different modalities, right? So now let me just explain to you what we do. So what you see here is the heart, and you see the slices, the horizontal and the ventricle slices that we get from the phase construct imaging. And you see that as the heart is beating, you see the motion of these red dots. So this is basically what is the motion of each of these markers during the heartbeat, right? Now, apart from this data, we would also we will also get a reconstruction, a very detailed reconstruction of the ventricle and the surrounding vessels, as you see here. So now what is the challenge? Is to take this very detailed reconstruction of the ventricle and animate it to do exactly what our heart is doing using the information we have on a limited set of markers, these blue and red markers. To do this, we use tools from differential geometry. It's a technique, it's called large deformation diffeomorphic metric mapping. There is an open source library. We used it to develop our own custom tools to do that. And what we ultimately do is that we generate a continuous moving three-dimensional geometry that is compatible with CFD solvers, right? Now, I don't want to bother you with equations and so on, but the whole idea, this is all a tool that it's very powerful. It's actually, you develop this, you have a reference configuration, and then you develop analytical transformations. And you're mapping each of the states to this transformation. And then we use the transformations to deform each point on the reference configuration and match it to the data sets we have in a way that we control the error. Here's the result, right? So what you see here, this is your reference configuration in the middle. That is a high resolution surface that has a very high quality surface grid that you need for CFD. And then on the side, you see the motion of the markers, the green and the red. And now the result of the tool is that now we're mapping the motion of the ventricle to how these markers are moving. And now you have a fully animated ventricular wall that is moving as the imaging data that we acquired. But the difference here is that this is high resolution in space and time and is ready to be used in a CFD computation. Now, let's go to the next step. The next step is the CFD. Now, this motion of the ventricular walls, unfortunately, it does not make your life easy if you want to perform a computational fluid dynamics simulation. Any standard solver will not, it's difficult to use it because of these large motions and deformation. So let me give you an example. So if you have, for example, this cylinder here that moves from this location to the other location, when you use a boundary conforming grid, the grid needs to basically deform to conform to the new location of the cylinder, right? While if you use what we call an immersed boundary formulation, and where you relax the requirement for the grid to conform to the body, the grid remains the same and the body just moves to the new location. So this is the method we're using. This is much more powerful for this class of formulations. We call it an immersed boundary formulation. This is a tool we've developed for the last 20 years. It's in-house. It's very efficient. Scalable, we can run it on large supercomputers. Here's an example. This is, let's say, a testing chamber for artificial heart valves. So you see here, it's a fluid structure interaction problems. We are testing a bileaflet valve. It opens, closes, and we use exclusively this type of tool. So this is the tool we will be using to do these simulations here. Again, I will skip the details of how this tool works. as we will be running out of time, I will show you that we cover a fairly wide range of flows with this type of tool. So here is a very large, this is one of the largest simulations done. It involves like 18 billion degrees of freedom. The flow around the golf ball is done on one of the largest supercomputers in the US. This is a bouncing sphere. Again, on the wall, it's a problem with a moving boundary. This is an owl, a model of an owl. Actually, the kinematics, again, are obtained with a similar technique from a flying bird in a wind tunnel. Or here is a flying insect that you see. So this method really can be applied to a very wide range of biological flows and other flows, of course, not just in the heart. And we've done a lot of work over the years to make sure that it's efficient and robust. So let's go back. So what do we do now? We have our model, right? And now we have our method, this immersed boundary method. So we get a cube, we generate a uniform grid. This is in this example it involves 512 points in each direction. We have some boundary condition here from the imaging data, and we perform the simulation that will give us what will be the flow field inside the ventricle on this grid, and for very high temporal resolution. Our time step here is one heart cycle is divided into 10,000 time steps. So we have a lot of information doing these simulations. Now, what we have done as a first step, having established the tool, done some validation, is to look into 5 patients that you see here, TOF 1 through 5. You see it's our patients that are age 6, 10, 12, 17, 30, and one control. So a control is basically somebody who doesn't have the disease, and we will use it as a reference to compare the differences in the blood flow in the heart. And the control is a 10-year-old. So I don't want to bother you with all the metrics and the details, but this is all done at the Children's Hospital of this. We acquire the images, we use the process that we just discussed to extract the kinematics, and then we do simulations. Basically, we will look into the vorticity, the turbulent kinetic energy, and we will also compare them to what we get from 4D flow data. So this is a snapshot of the different cases. So when you do the analysis of the kinematics, you see, as you can see, these are also very different ventricles. You know, all these patients, there is no norm. The shapes and the kinematics of the ventricles, because of the nature of this disease, are different. So that's why it's very hard to make generic predictions, and you really need patient-specific type of tools. So the control is at the bottom, and all the other cases you see are shown on the rest of the screen. So let's just focus in one. This is case number 4 and the control case. So I just show you a slice here with some velocity vectors, and you can see, if you look hard enough, you can see there's a big difference here between the two. And the difference is that in the case of the disease situation, you do have, so this is the pulmonary tract, and this is the tricuspid tract. You have 2 streams, 2 jets that are formed because of the regurgitation that are colliding, while in the control case, you don't have something like that. I think this is more visible. Here is some 3D visualization of the vortices, but I think here it's a little bit more clear. So you see that during the filling of the ventricle on the left side, where you have the control case, you see the formation of a donut vortex. You see that it is visualized by the streamlines. So you see that as the ventricle is filled, you are forming this donut vortex that is very, very important for the mixing and everything that happens inside the right ventricle. Now, for the case of a disease, you do not have this donut vortex, but you rather have these 2 streams, these 2 jets that are coming in and they are colliding with each other, which are changing significantly the mixing inside the ventricle. So that's one of the big differences. And of course, if you go and look carefully into all the different cases we examine, then the actual geometry of the ventricle and the actual conditions may lead to these jets colliding or not colliding, or having different dynamics and so on. I will stop here and summarize and so give a summary of what we've learned using those tools, right? We have this large qualitative difference in the disease and control cases for this particular type of congenital heart disease that leads us that this may be a good path in identifying much more sophisticated biomarkers that can guide the replacement. I will finish with acknowledging, everybody that has been working on this. The big picture here is the team at the Children's Hospital. These are pediatric cardiologists, imaging specialists, surgeons, and so on. And Francesco, who is now he started this project with me as a postdoc in the lab. He's now a professor in Barcelona, in Spain, and we still work on that together. So I'll stop here and I will take questions. Thank you.
Great. Thank you so much, Dr. Balaras. That was so informative. What we'll do is, instead of doing questions right now, if you don't mind, Dr. Balaras, we'll have a short presentation about the GW School of Engineering by Erin and her team. She'll try and give us some bit of insights about the GW School of Engineering, what kind of programs, admissions criteria. And Erin, please, can I request you to also cover some bits about scholarships, because there are a lot of students who might be interested in that. And I might have a couple of things to add, because GW has a special scholarship with Seed Global Education. So I'll be able to do that as well. And then we'll do some bit of Q&A about the topic itself and about the George Washington School of Engineering. Before I let you go ahead, Erin, just a reminder to all the 380 odd people still here. Please use the Q&A tab to ask any kind of questions you want, either to Dr. Balaras or to Erin, about the program or about the topic itself. And then if the students are interested in a question, please like that question or upvote it and we'll ask the relevant ones. So look forward to your questions shortly, and over to you, Erin.
Great, thank you so much. Well, I'm really happy to have a few minutes to talk to you about some of the graduate programs that we have here at GW. I'm afraid my work might not be quite as significant as Dr. Balaras's, and likely not as interesting as well. So that's a tough act to follow, but it is important. And one thing that I really want to kick off the presentation with is just talking about what makes up a best fit choice for you. So if you are considering joining a graduate program, GW prides itself on finding some of the best and brightest students around the world to join our engineering programs. But we want to make sure that we're the best fit for you as well. So we encourage students to think about the location of a school, the quality and curriculum of a program, the facilities that will be available to you as a graduate student, career services, the alumni network. That's a huge part of what you're investing in when you join a university. And then, of course, cost and types of financial assistance. I know we already got a question about scholarships. I'll be happy to talk about that. But I want to hear what other questions that you have and what other worries that you have when you think about your options for finding a good graduate program for your future needs. Let me tell you a little bit about what we do here at GW. So at GW, we have over 2,500 full-time faculty members and over 25,000 students. One thing that makes us a bit unique is that we have more graduate students than undergraduate students. So we have more than 15,000 graduate level students here, and that really speaks to a strong emphasis that the university has on graduate education and on the opportunities and resources that graduate students need to be successful in their programs. Here at the engineering school, we have 6 academic departments, one of which is, of course, Mechanical and Aerospace, which you've heard about today. We have 11 different fields of study, over 90 tenure and tenure track faculty members, and 22 million in research spending. Now that might just sound like a random number. Just a few years ago, that was around 20 million. It's growing rapidly. And that really is another factor that speaks to the type of opportunities that can trickle down to graduate students in terms of the amazing faculty that we have at the university, the research work that we're doing, the technology that our students have access to. And we talked about facilities. So this is our Science and Engineering Hall at GW. This building is less than 10 years old and is sort of the hub of all the work that we're doing. It's where our academic departments are located. It's where my office is located. It's where a lot of our research is taking place. It's where a lot of our students meet and gather. It's where we have a lot of events throughout the year. It is also where we have a lot of technology that our students may be engaged in research and throughout their program. So things like a class 100 nanofabrication clean room, a high bay with a strong wall and strong floor. There's some really interesting research going on here within the building. And our students definitely meet and greet and study and work here in and out of here throughout their day, throughout their program. Just to give you a heads up about the programs that we do offer, the list on the screen is our MS programs. We offer a lot of different areas of focus, concentrations within these programs, just tailored to your interests and sort of where you want your expertise to grow as a graduate student. Likewise, these are our PhD programs offered in similar areas. With some of our key areas of growth, as Dr. Balaras mentioned, research going on in artificial intelligence, in computing technologies, in medical fields, and biomedical research going on. So there's a lot of exciting work going on with our PhD teams. I'll mention briefly scholarships. I know, like I said, we already got one question about that, and I want to be sure to give you the information that you're looking for. Master's students here at GW are considered for scholarships that range from 25 to 75% of the tuition cost. This is based on merit, so based on your prior academic work, your experience, your references that you provide, your statement talking about your motivation for joining the program. Those are all significant factors when we consider students for these scholarship opportunities. And then at the doctoral level, many of our admitted PhD students are receiving teaching assistantships or research assistantships. So these typically come with tuition waivers and with a monthly stipend to help offset your living expenses. So if you're an international student, these funding packages will be considered full funding packages as well. Career services, as I mentioned, is something that I feel like is really important when you're looking at programs and considering what program will be a good fit for you and will have the resources that you need to succeed as a student and beyond the program. At GW, we have the W. Scott Amy Career Services Center. This is specific to GW Engineering. It's located inside that Science and Engineering Hall. And so our career coaches on that team have significant experience helping engineers and computer science scientists scout out, prepare for, and achieve the opportunities that they're looking for. They also have extensive experience advising on CPT and OPT experiences. So if you are interested in getting some work experience in the US during or after a graduate program, they can certainly guide you in helping to identify the best opportunities, making yourself a competitive applicant, and making sure that you're following all the necessary procedures and guidelines to be successful in that regard. I'm just about to wrap up, so please be thinking about any questions that you have. The most interesting part of these presentations are always sort of the discussion at the end when we can address individually the questions that came to you during our presentations. So GW and and Washington, D.C., just talking about what advantages we have as an institution and our location. So we have, as I mentioned, 6 specialized departments within the School of Engineering. We offer small to medium class sizes in our programs, allowing for a lot of interaction with students, with faculty. Our faculty are leading researchers in their area, so they bring a lot of expertise and a lot of opportunity into the classroom. And we also have a lot of long-standing connections with employers that our students really benefit from. So I know Dell, as an example, has been on our campus many times in recent weeks, meeting with and interviewing students. We have students working with Microsoft, with Facebook, Meta, Amazon, Capital One, like a lot of these big institutions and big names that students would be interested in working with. We may have career connections too, professional connections, alumni connections within the organizations that can help support you as a student as well. And my last note is just that I know it's interesting to hear from faculty and staff of a university, but it may be even more interesting to hear directly from students studying at that university. So I've posted just 4 of our current graduate students. These 4 are 4 of our graduate ambassadors this year, which means that they're available to chat and talk to prospective students. If you have some general questions about our programs, about what it's like to study at GW, what it's like just to study in the US, they are available to chat with you and answer your questions. So that's available on our website, and we encourage you to reach out and talk to someone who's been through this firsthand and is being successful currently as a graduate student. And that's all I have for you today. So I'm excited to hear what questions you have for us. I do want to offer anyone who joined us today an application fee waiver. We are understanding that there are a lot of challenges with applying to graduate schools, and we don't want the fee to keep you from applying. So if you learned a lot from us today and feel like GW would be a great fit for you, then we would love for you to apply, and we'll waive that fee for you. SEED OCT October 23 is the code. And so just jot that down, and you can enter that at the end of our online application. Our website and email address is on the screen here. Myself and just a few of my colleagues manage these emails all day, every day. So we'll look forward to hearing from you. But now I'll turn it over to our trusty host for some questions from the audience.
Great, wonderful. Thank you so much, Erin, for this wonderful presentation about George Washington School of Engineering. We've got already a few questions that I've lined up. I think Dr. Balaras will be busy for the next few minutes answering some questions about coursework, especially. So I'm going to keep you through some of that. Just one quick point. If you're looking to apply to George Washington School of Engineering, there's also another exclusive scholarship that's being offered along with SEED Global Education. There are 4 scholarships on offer: 1 75% scholarship, 2 scholarships for 50%, and 1 scholarship for 25%. So 75, 50 and 25% of the tuition fees will be completely waived off if you get the scholarship. I've check out the chat. There is an interest form that you will need to fill in order for you to be eligible, and we'll take you through what the next steps would be. I've also posted the application fee waiver code for folks who are looking to apply to George Washington School of Engineering. And I have a quick poll question to actually check, and you can see that on your screen right now. Question is, when do you plan to start your master's degree in the US? And we've kept a couple of options like 2024, 25, or if you're not sure of which year, but you're sure to start your master's in the US, I think that's an option as well. Or if you're not sure to pursue your master's in the US, you can tell us that, and you're just here for the session by Dr. Balaras. We've got close to 60 odd folks who've responded. We're waiting for a few more folks to respond. So if you can click on the poll button on your mobile screen, or if you're on your laptop, there's a poll that's right there. We're just waiting for a few more people to answer the question on when do you plan to start your master's degree in the US? Superb. Just waiting for a few more people. If you haven't answered, now is the time that you look at the poll question and you answer that. Cool. I've got close to 80 odd responses by now, and just sharing the results of the poll on your screen. And we have a large percentage, close to 60% of students that are planning to start in the next couple of years. So 60% of the audience is looking to start in the next couple of years. 22% are not sure when they're looking to start, and about 20 odd percent folks are interested in the session, which is why they've been here, but not sure if they want to pursue. Maybe this session has changed your mind and will help you pursue your education abroad. Great. So I'm going to now move on to questions. We've got about 15 minutes of Q&A that's to be done. Thank you so much for everyone who's asked questions. And if you have more questions, please do ask them in the chat box, or rather the Q&A box. Great. So my first question is by Aditya. And I think Dr. Balaras, he's asked that he has a background in biomedical engineering, and his areas of interest is computer programming and biomed amalgamation. What would you suggest his coursework should be? What kind of course should he pick up if he wants to focus on computer programming and biomed amalgamation? And what are some of the key subjects that you think that Aditya can pick up?
Yes, actually, we have a biomedical engineering focus within mechanical engineering, which allows students that are interested mostly in biomedical technology and biomedical engineering to focus on that. So we have courses on structural mechanics, we have courses on fluid mechanics, on CFD, on computer programming. I mean, actually, two of these courses I teach myself, and we also do quite a bit of work that is related to this type of research. So we use some, in class, we develop tools using a higher level language, of course, so we don't exclude students. We use Python, and we write our own solver and everything. So there is, we do have a biomedical engineering discipline, but I want to say here that every student is unique that is entering our program, and we will work with our students to give them and develop a course plan that reflects their interests. Of course, within the focus area of mechanical engineering. If I see that the interests are mostly in electrical engineering, then yeah. But within the broader area of mechanical engineering, we do our best to custom build a program that fits somebody's interest. And sometimes, these interests change. They come in, they see, oh, well, now I took this lecture from this professor. I want to learn more about it. I want to do some research on that topic. So these things, we're very flexible in accommodating and we want every graduate student to be the best they can be, and that's what I will work with them to, on coursework and research and everything, given that there is, of course, the opportunity that they are looking for. Yes.
Great. Wonderful. Thanks so much for that, Dr. Balaras. Erin, my next question is about PhD programs. If you can share the approximate duration of these PhD programs, there's a couple of questions, and also throw some light on the integrated programs between Masters and PhD.
Ooh, I'll do my best. Okay, in terms of the duration of PhD programs, so typically we usually tell prospective students to expect between 4 and 6 years. We do allow direct entry PhD candidates, so you can apply with just a bachelor's degree. In that case, you should expect your program to be on the longer side, because you'll have to do more coursework and earn more credits in the early year or two of your program. If you're coming with a master's degree already and then moving into the PhD, then of course the program would be a bit shorter, but is based on a lot on the research work that you'll be doing and how soon you can get through that. In terms of integrated programs with master's and PhD, if I understand the question correctly, we don't offer a joint program like master's en route to the PhD. They're separate programs at GW, and they would need to be applied to separately. So if you're just coming from a bachelor's degree and don't feel like you're highly qualified yet for the PhD, then you would apply to the master's program, do those 2 years of study. That would shorten the duration of your PhD program. You could apply to the PhD program in your second year of master's. Otherwise, like I mentioned, you can apply direct to the PhD program with a master's or with a bachelor's, although of course the admission is quite competitive, and particularly if you have just a bachelor's degree, quite competitive.
Great. Wonderful. Thanks for that, Erin. I think that was very well explained about the fact that, the progression to a PhD course. My next question to you, Dr. Balaras, I think we tried to address, someone who'd come from an engineering background, interested in medicine, but there are some folks here. Yashveen from Chennai is pursuing her undergraduate in physician assistant studies, and she wants to try and build her career in the health science field, health science and specialty. So what kind of coursework? I know you've covered a lot of this in your previous answer, but just from a point of view of someone coming in from a health sciences background, what can you recommend some bit of coursework for some of the programs that are on offer in the engineering space?
Right, that's a great question. I cannot give you like a definite answer, but because as I said, every case is unique. What we do is we look. You send us your transcripts and the school you finished, the background. Maybe you have done as a student in the medical field, maybe because you liked it, you took already some courses in the engineering school, and you have some. So it's really done on a case-by-case basis. But certainly, if you have not taken any type of technical undergraduate classes in mechanical engineering, I've just mentioned like dynamics, fluid mechanics, calculus, basic programming, it is very difficult to go through the master's program. So we want people that we admit to be successful. And so if we judge that your background is not sufficient, then we will either tell you, well, there is too much that is missing and it's hard to, or we will give you a list of courses that are prerequisites that you have to take prior to starting your master's or PhD, right? So that's but it is done on a case-by-case basis. We take a very careful look into all these cases and try to make sure we understand what is exactly the background of the student and how we can best advise them on the career path. But it's not uncommon. We have biologists, we have I have now a medical student in my lab that is working for me because he's really interested into this. So we have all sorts of different backgrounds and people, but it's on a case-by-case basis.
Sure. That was rather my next question, Dr. Balaras, about what kind of student backgrounds are coming into this program, because there have been questions about, hey, I'm from a biomedical, engineering background. Do you think I would fit? Or I'm from a MBBS, which is a medical background. Do you think I will fit? But for everyone who's asking the questions, yes, the answer is yes. If you have a background in biomedical engineering or MBBS or even pharmacy, I believe, do you think students from a pharmacy background will find this course interesting as well? Or just to add, if not this course, any other courses at the George Washington School of Engineering and Applied Sciences that you think would fit the bill best for them?
Yes, I think, biomedical thing with biomedical engineering is that it's very broad, and there is a very broad, let's say there is a very broad range of fields and that people are involved, right? So people are work on drug development, device development, imaging. So that's why I would say I don't want to discourage anybody from applying. If you have a systems background, biomedical engineering background, pharmacy, if you think that this is what you really want to do, I would encourage you to apply. And then we will try to advise them the best we can. Because as I said, this is done on a case-by-case basis. I mean, not two cases are the same, especially within this very humongous international environment. There are so many different schools, they do things in a different way. That's the best I can say at this point.
Yeah, I would just add to what Dr. Balaras said, that on the one hand, our programs at GW are very open to students coming from diverse backgrounds. So and we love that for our students. Part of what makes the graduate program so successful is peer learning and learning from other students' backgrounds and stuff. That being said, a graduate program is of course a program where you develop a very specific expertise in this area. So it's not really designed to provide the basic background knowledge of a subject area, but to help you, ensure that you're a master, so to speak, in that subject area. So I think, all of our programs are open to students coming from different types of engineering backgrounds, or even potentially non-engineering backgrounds, as long as the core knowledge is there that would allow them to be successful at a graduate level.
Wonderful. That's very well answered as well, I believe. So if you have a background in any field, but you have some bit of inclination towards going into a particular field, I believe Erin and Dr. Balaras have shared some insights about the fact that you can at least start your application, or at least write an email with your profile to the admissions team. They might try and give you some tips about that. My next question to you, Erin, is about this particular aspect, right? How can students reach out to you? Do you think that they can write an email to you with their profiles and with their program or programs of interest, so that you can give them some feedback about fitment? And the second part of the question is, what kind of tips would you like to give students that are looking to apply to GWCs to ensure that their application stands out and they increase the chances of getting selected?
Sure, I might give the same answer sort of for both questions. So I think what's most important here is to really take a look into the programs that we're offering. Each of our program pages on our website details that the sort of outlines the curriculum of the program and the type of coursework that you would complete in the program. So going through that and making sure that coursework excites you and interests you and would get you to where you want to be professionally is sort of step one of your research. You can also see directly our list of faculty in every program, the research work they're currently doing. So there's a lot of information out there that you can gather to help determine if a program seems like it would be a good fit for you. So for both of the questions that you asked, I think that is such an important step, because once you do that, if you have questions about finding the program that's a right fit for you, or if you're qualified to apply to a program, then definitely reach out to my team, engineering@gwu.edu. It helps if you can attach your transcript, especially if you do have some questions about different backgrounds. So for example, some students with an HND, if you're coming from Africa, Nigeria, or 3-year degrees from India, in some cases don't qualify to apply, and in some cases might. So those specific questions, please direct to my team and we're happy to help. In terms of making your application stand out, do your research, know the programs, know our faculty, and you really have the opportunity to talk to us in your statement of purpose and tell us why you feel like GW is that great fit for you personally, how you feel like you can be a really successful graduate student in our program, and what are your future goals, and how our program is a great match for helping you get there. So I think the more specific you can be about your interest in our work and our faculty and our programs, the better we'll see you as a great, strong fit for our programs.
Great. Thank you so much. My one last question, because we just have 1 minute left. Sorry. for this, any bit of extracurricular activities that you recommend students can write in their in their application? And secondly, what kind of other activities apart from engineering, apart from the professors and classes that are happening at GW, what are some of the other extracurricular activities that students can enjoy when they are at GW?
Ooh. I'll give a quick answer and then I'll defer to Dr. Balaras if you have any advice about like what you like to see students having participated in the past. But in terms of extracurriculars at GW, I mean, that's definitely an exciting component of being a student here, and you don't have to stay in the science and engineering hall at all times. We have a lot of organizations. We have sort of religious and cultural organizations. We have sport organizations, the gym and the library and all these different things, guest lectures going on around campus. So we really encourage students to get involved across the campus. Of course, within the engineering school and the science and engineering hall, we have some engineering focused teams and groups and activities that are really fun for the students to engage in as well. In terms of what you might put on your resume when you're applying, we love to see people that have any sort of leadership or organization experience that shows that they can sort of coordinate efforts and oversee projects, oversee initiatives, manage a big group of people. That's a really great asset that we could bring into our graduate program. I defer to Dr. Balaras if you have anything to add.
Well, that's really very difficult, but what I'm looking for when this applies not only to grad students, but in general in life, is I'm looking for people that are passionate in pursuing something and highly motivated, and this you can see usually in somebody's path. And these are the people that gives me the greatest pleasure working with. If you're passionate about something so that's one of the, I think, big qualities in succeeding in grad school and doing great and leaving this world a little bit better than what it was. So this is always done by people that are driven, that are very passionate, and we're really looking to work with this type of people because that makes us also better and gives us a lot of pleasure in doing this job. So that's what I think is, to me, this is the most important thing.
Wonderful. Thank you so much, Erin. Thank you so much, Dr. Balaras, for this last 1 hour, answering patiently about close to 85-90% of the questions that were asked in the Q&A tab. I think we have spent the best part of 1 hour taking students and prospective students of GW through this wonderful sample masterclass, if how I'd like to call it. It's like a sample masterclass. This is what you would learn when you are at GW, and a lot of more in-depth information. Maybe you'll get to meet Dr. Balaras in person as well. Just a quick reminder, if you're interested in taking the application fee waiver while applying to GW School of Engineering, it's mentioned in the chat. It's SEED October, it's SEED OCT 2023, so please use that. And if you're looking to apply to the SEED scholarship, and if you're looking to apply to GW, then you can fill the form that is mentioned in the chat as well. Thank you so much to the 250 odd of you who are still here, waiting patiently, listening to Erin, Dr. Balaras, and myself. Thank you so much for taking our time on this wonderful evening. And very importantly, thank you, Erin, for taking our time, in the morning, and Dr. Balaras as well for this wonderful class.
Thank you so much. It's been
Thank you so much. Likewise. Have a nice rest of the day to you folks, and good evening, and enjoy your evening to everyone joining us from India and other parts of the world. Goodbye and take care.